this is so exciting. We're going live with an actual real life dermatologist. Dr. Emma. Oh, she's here already. Dr. Emma Craythorne. So before we even start, Dr. Emma Craythorne developed Clearer, which is prescription skincare delivered straight to you. But whilst we have an actual real life dermatologist amongst us, if you're watching this now, jump on in. If you're watching this afterwards like a podcast, please feel free to ask any questions in the comments afterwards, and we'll ask Emma if she will dive in afterwards and answer some of your questions. She's here already. I can see her. Yay! Pop anything you'd like to ask in the comments with this feed, and we'll ask Emma if she'll jump back in here over the next few days and come in and answer the questions. Hello.
Hi.
Hello. Oh, it's so lovely to see you. I follow you on Insta, but we haven't met before, have we?
No, we haven't, but I've been doing exactly the same thing as you. So we've been stalking each other, but we just have never met. So this is lovely. I've got a bit of a wonky stand, so apologies if this keeps going up and
surrounded by
down.
lights. None of them work properly. I always laugh and say anybody that's been on social media between the last 10 years will suffer with this thing called bloggers blindness in about 20 years time. Well, we won't be able to say a thing because we've been surrounded by these crazy lights our whole life. So we'll jump straight in. I want to jump straight in because we need to keep it under 30 minutes for everybody. So I want to jump straight in. You are an actual dermatologist, which means well, you tell me, what's a dermatologist?
So a dermatologist is a doctor who has a special interest in skin. So it's a bit of a long journey to be a dermatologist. So you go to medical school for your 5 years, and then you'll be a junior doctor, which is obviously what everybody's hearing a lot about in the news at the moment. So I was a junior doctor for many years, but 3 years in internal medicine, 2 years in surgery. And then you go into a specialist training program, which is 5 years as a dermatologist, and then an additional specialist year, and then finally you're a consultant dermatologist. So the shortest path, I suppose, is like a 13-year path, and the longest can be, even longer than that. That's what you need to be the dermatologist.
That's some serious education right up there. And then, as a dermatologist, we'll jump straight in. You started Clearer, haven't you? Why did you start this skincare brand, Clearer?
Yeah, so I started Clearer because in my private practice, as well as in my normal NHS practice, I see a lot of patients with these very common facial skin problems. Whether that's from people who have acne, whether they've got rosacea, or whether it's people in my my Harley Street practice who just want to do seriously better aging. And the fact is that I knew that I would be able to, in some way, if I could come up with an algorithm and use the AI that we currently have, be able to service and help so many more people. So that is where the idea for Clearer came around. So it's essentially my private practice dermatology clinic, but I'm able to now, with the wonders of AI and all the algorithms that we have, service so many more people. So that's how we can get the people. And then all of these people who were in the past, just had either a lot of money or celebrity status or whatever, we were making these prescription formulas for them. And now we're able to make that available for everybody.
That's such a clever. So instead of just literally being only able to service the people that can physically get into your clinic, now you can go beyond that with Clearer. Okay, that's incredible. Yeah,
that's really it. It's really truly about accessibility. So it was being able to help as many people as possible access that kind of a service.
What kind of stuff can you get then from someone like yourself, a dermatologist, that we can't just go and pick up on the shelf?
Okay, so say for example, you want to think about somebody who might have a red face. So there's many reasons for a red face, one being seborrheic dermatitis, one being a tendency to rosacea, and there's a lot of other ones. Now, if we think about what we want to do as dermatologists is calm down the inflammation and improve the skin barrier, well, we have access to drugs that we know are the best evidence-based treatments for treating these conditions that unfortunately you just cannot buy over the counter, because you need to be under the guidance of a doctor and you need to be told how to use it properly, and some of them have side effects, so you need to be able to be with a team that can deliver that care to you properly. So it's just really about the fact that many of these things are actual medicines or drugs. And the same thing even whenever it comes to many of my patients who want to do, serious better aging of the skin. A lot of the treatments that we might otherwise be able to access over the counter are kind of smaller derivatives of such as the things that we can prescribe for people in
so it
our
should
private practices.
Be accessible to everybody on the shelf. You need this via a professional such as yourself or your team. Yeah, but you need to get this via a team. You need to be under a professional. So when we go to Clearer, now I have one here. I love the I've got to show the packaging because I love this. So this is Clearer World. Well,
because we're so proud of the
is
packaging.
Awesome because, well, I shall hold it up like your glamorous assistant, and you tell us what this is.
Thank you. Okay, so what you're seeing in front of you now is the glass canister, and that glass canister, it opens up just as Korinna's doing, and inside you will see a cartridge. Now that cartridge is your prescription for the month. It's made fresh in our pharmacy and delivered direct to your face in less than 24 hours. So we have from farm to face in 24 hours, but that will do you for the month, and it is exactly the amount that your skin needs or requires for that month. And then after that, what happens is that
no, keep going. No,
I frozen?
I see.
Okay. Sorry. And what happens after that is the following month, you then get a refill of that. So that next refill will then last you for the following month after that, and it keeps on going. Now that little cartridge is in there, that's a fully recyclable cartridge, and eventually one day we're working on it being fully compostable, but at the minute it's completely recyclable. So the whole thing really was designed as a secondary reason really that we wanted to just do away with as much waste as possible. And we actually have a whole group, and I'm sure some people are joining here now, that are our Clearer addicts who share stories of how they try and desperately, if they can, just to get little bits more out of the cartridge. This is glass.
This is fantastic. It's beautiful on our shelves too. So I have done this. I've been on your website. I had my consultation to get my little pause on this. So when I did my consultation, this is just kind of me talking to you, I thought the consultation online was really, really thorough. I was asked a lot more questions than I've been asked before when I've experienced a similar kind of thing. And then my little I want to call it potion, but it's not, but my bespoke cream arrived in the post for me, and then I'm using this in the evening, 2 pumps. Now when we have this delivered to me, mine's got lots of fancy ingredients in there that you can't just go and pick up off the shelf in Boots or wherever. And then, so for me, I'm using this 2 pumps in the evening, but this is layered within my skincare that I'm already using, right? So I'm using my usual morning routine, my SPF, everything else. So where does this slot in? This goes in the evening. Can we skin cycle with this? What do we do with this? Can we miss an evening? And then also how much support we get, because for instance, if I had these questions, which I know it's going to tell me, if I have these questions, what can I do to get my questions answered?
Well, first of all, if you've got any questions about anything to do with Clearer, or whenever you're on the journey, we have a full dermatology team. And this is a dermatology team of people who are true dermatologists. They have worked with skin in dermatology team with me for decades. So there's a full team there to answer all the questions that you might have. And so that's your first port of call. When it comes to thinking about what is in your own prescriptive formula, it's essentially prescribed just for you. So everybody will have a different formula for whatever their clinical need is. So we always say you could go online, you complete your consultation, and at the end of the consultation, you will then have a skin routine that works out exactly for you for the rest of your life, essentially. But your Clearer Special is the thing that will treat your concerns. So everybody does still need a cleanser, a moisturizer, and an SPF for during the day. But at nighttime, all you need is to wash your skin and put your Clearer Special on. That will have in it everything that you need to treat the concerns you have, whether it's acne, rosacea, better aging. but also it has all of the wonderful, nourishing, barrier supporting treatments that your skin also might need. So as well as all those luxury things like the hyaluronic acids and the squalene and the ceramides and the hydrolyzed collagen, all of those lovely moisturizers, it also has the actual active drugs or ingredients that are going to do the job to fix the skin concerns that you have.
I've wasted a pump on the back of my hand. As I was doing, I thought, I've wasted it on the back of my hand. So I want to go back to these wonderful ingredients. So there's this mystical thing called tret, which we kind of hear thrown around, this word tret, when you're talking about prescription, etc., and things we can access through a dermatologist like yourself and your team. This mystical thing called tret that we hear thrown around, what is tret?
So tretinoin is the gold standard treatment that's used for a number of different medical conditions, including photodamage, which we will know as aging of the skin. And that is where you get fine lines or coarse lines, wrinkles, you get changes in color of the skin. It can either become more yellow or you can develop lots of little blood vessels. So there is a condition called photodamage. Now, in the late 80s, early 90s, it was discovered that there is a chemical called retinoic acid, or tretinoin, and studies were carried out using this chemical on people who had advanced wrinkling and skin damage. And it turned out that it was able to improve those over a long period of time. So you would have patients who had had this severe photodamage, wrinkling, and this was able to then improve those and tell the skin to make more collagen. And it is the only ingredient that we know that has this FDA license, again, way back in the 90s, to show us that it's effective. So it is essentially the holy grail drug that can reverse the signs of sun damage and skin aging. The derivatives that you then get from that are things like retinol or retinol, and they're available to get over the counter, but they have to go through several conversions until they become the tret or retinoic acid, and therefore they are always much, much weaker. I mean, probably in the region of about up to 70 times weaker than the effect that you can get from actual tret. So yes, they're safe to sell and they're easy to sell because people don't run into issues with them, but equally they don't have anywhere near the level of evidence that a drug like retinoic acid would have for something like skin aging. But in addition to that, you also have the effect that it can have on acne. So for people who've developed acne, slight clogging of the skin and developing these red spots, people will that is the gold standard treatment for that condition as well. So it really is a pretty wonderful ingredient for conditions as acne, where it's considered gold standard, as well as photodamage or aging, where it's also considered gold standard. Whereas the derivatives of it are just not quite so strong.
Yeah,
but have very good marketing.
Yeah. But with great power comes great responsibility, I guess, and that's where literally your team, team comes in, because it's so active. So this is suitable for everybody from acne, which and congested skin, which is where you say it's gold standard, right up to skin rejuvenation, all across the spectrum. Can everybody tolerate it in certain amounts, or there's some people that can't tolerate it?
Yeah, so one of this ingredient isn't by any means in all of our specials. You know, whatever you require for your skin is what you will get. So only if you need it, you would essentially get it. But in answer to that question is yes, if the drug is required by your skin to treat the condition that you might have, then yes, it can be tolerated. It was a very old-fashioned view to think, oh, my skin can't tolerate these retinoids. If it's not been able to tolerate it, it's not been delivered properly. So it's so important that the medicine is delivered in the correct way. And by delivery, I mean the vehicle it comes in, the nice supportive cream that has the hyaluronic acids and the collagens and the cholesterols and all of these things that help to deliver it to the skin in the best way.
I've seen a couple of questions flying in. So someone said, what company are you from? So Dr. Emma Craythorne is the founder of Clearer World. And someone else said a while ago, and I just saw it flashing, does it just sit on the skin? Which is a really good question for a dermatologist. So I'll hand that over to you.
What does it just sit on the skin? The drug
tretinoin? I was talking about this. So does this sit on the skin? So when I apply this to my skin, which would normally be my face, I wouldn't be wasting it on the back of my hand. When I apply this to my face,
You're
Well,
not
I use.
wasting it on the back of
I
your hand.
always put the excess on the back of my hand, but I wouldn't blob it on like a hand cream. But I
Yes.
always rub the excess on the back of my hands every time. And then use an SPF by day, because we've been rubbing this on the back of our hands in the evening, and SPF by day. Anyway, I'm not the expert, you're the expert. So when we put this delicious potion on our skin, as someone said earlier, does it sit on the skin? What does it do when I put this on my skin?
So, okay, so when you put it on your skin, it again really depends what is in your particular product. So for some products, the ingredients will sit in the skin and provide a nice little skin barrier. But some of the other ingredients, for example, if there was tretinoin in it, it communicates with the cells that are actually in the dermis. So the way that the tretinoin works, it's essentially working a little bit like a hormone. So it's a strong vitamin A, and it's telling cells like the fibroblasts to switch on via these receptors. So it works with receptors on the top of the skin, but it also works with receptors in the mid part of the skin. And it tells them to make collagen, make hyaluronic acid, and stop breaking down collagen. So that's the three main ways in which it works for skin, better skin aging, I suppose. When it comes to working for things like acne, it works by telling the top layer of the skin cells to start to turn over in a more regular way. So these skin cells become less clogged up and blocked.
Okay, so, and when talking about this prescription skincare that is available through Clearer, I have to ask you, you're not the only people doing this. There are other people doing this, other brands that are doing this. What makes you different to the other brands that are doing this right now? What makes you kind of stand out? Are you doing something different to them?
Well, we I suppose feel that we are doing something different, which is why we started it essentially in the first place. So, first of all, reason of point of deliverance is that this is a dermatologist-led service. It's not a pharmacy-led service. It's not a business-led service. This is all entirely dermatology-led, inspired from our dermatology clinic. So that's the first point of difference. I think the second point of difference is that we use a lot more information about our patients. So we gather a lot more information. We're assessing what the genetics are, what the epigenetics are, and we're also trying to plan what's potentially in store for that person in the future. So it is a more holistic level of care, we think. But lastly, and probably most importantly, is that our prescriptions are much more precise. We have this is a luxury base. These are lots of the luxury ingredients that you might want to buy whenever you walk through, I don't know, Selfridges and you see the beautiful things on offer. We have all of those ingredients in our supportive base, as well as the medicines that will do the job to help the skin concerns. So it is a dermatology service, but it's got this very precise prescriptive luxury skincare element, which is
Okay,
just
so you're
what sets it apart, I think.
Instead of it being an
But then
online
I'm biased.
pharmacy where we can sort of access things we can't ordinarily buy on the shelf, we're accessing, as you said earlier, we're accessing your team via the joys of AI. We're accessing your team so you can get to help more people than you would be by seeing people in your clinic. So you're still running your dermatology clinic privately. Do you still work for the NHS?
Yeah, so I still do work for the NHS. I couldn't bear to leave it. So yeah, so I do still work for the NHS. I work for the NHS 2 days a week. So I do my laser list, my advanced cancer lists. I do my Mohs surgery, head and neck operating 1 day a week. So yeah, so I'm full on still doing my NHS practice, and I think I will always do my NHS practice because, well, I mean, I love it. I'm certainly not doing it for the money, but
So
I
it's
do love
mind-blowing,
it.
really, when you think about it, that we can access your skill set and your team via our phone or our laptop or our tablet or whatever through Clearer World. So if we want to do that, we go online and then we pay for a subscription, don't we, to access Clearer World and to access your team. We go on and we fill in our form and we find out what our skin size is. This was, I found, unique to you. So can you tell everybody what your skin size is?
Yes. So that's right. This is unique. So this is really this is our.
Oh, I can't hear you. Hang on. Hey, you're back. You've gone again. You're back. You're back. You've gone. Hang on. You're coming in and out. You're
Back,
back. You're back.
back in
Yes,
the
yes,
room.
yeah. Yeah, yeah.
um,
So,
that,
yeah,
so skin sizing is essentially the way that we're able to deliver this service. So that's the most exciting reason of why we can use our current AI technology, I suppose, and all of these questions that we typically ask in clinic. This combination together gives us our skin size, and I'll explain that a little bit better. What essentially happens is that you will come on, as you've seen, and answer a barrage of questions. So you must sit
yeah,
down, this will take 20 minutes, have a cup of tea, and really think about the questions you're being answered. It's the same length of time that you would be seeing really in a dermatology consultation, and probably about twice the length of time if you were in an NHS dermatology appointment. This is an in-depth consultation. But based on that, I'm then able to determine what your genetics tell me about your skin, and what your epigenetics, in other words, the life that you have lived, in combination with about you. So it's this real combination of your genetics and your epigenetics that comes up with your skin size. But your skin size is essentially a combination of a number of different factors. Back in the day, we used to think, oh, you've got oily skin or dry skin. And I mean, now we know that that is just nonsense. Everyone's like, oh, dry skin here and oily skin there and all the rest of it. So what your skin size is, it tells you whether you have skin that makes a bit more sebum or less sebum, skin that has a barrier that's very sensitive or potentially quite resistant and strong. It lets me also know what your melanocytes are like. Are they making a lot of pigment, or do they not make a lot of pigment? Are you more prone to redness or brownness? And it also lets me know how your fibroblasts are behaving. Are they making good collagen, or are they making not so much collagen anymore? So it's this factor of the collagen, the pigment in the skin barrier, and this oiliness level, I suppose, or dryness level. These are the factors that make up your skin size. Now, if I was to tell you exactly what you were in terms of all of the numbers, it's so confusing. So we boiled it all down to a skin size. So like, your shoe size or your dress size, if you know your skin size, it just makes shopping so much more easy. So you know which SPF will suit you, you know which cleanser will suit you, you will know which moisturizer will suit you. But more importantly, I know which treatment that you would need at nighttime to fix the skin concerns that you have. So that's essentially is why skin sizing has meant I can deliver my dermatology service to
it's so
as
clever.
many
Someone had
people who need
a
it.
really good, interesting question a little while ago, who said, surely it's easier to just have a lower facelift, which I thought was a really interesting comment. But you answer this, but a lower facelift isn't tackling your skin health, is it?
That's right. So when we think about, so that would be somebody, say, who's maybe asked that
Yeah,
question because they want to have
yeah,
better skin aging, I'm going to say, or for aging purposes. But when we think about aging, it's actually the skin is the top layer of that. Then underneath that layer, you have the fat pads of where they sit. And then underneath that, you have the ligaments and the muscle layers. And then underneath that, you have the bones. And as we age, all of those things change. So our bones get smaller, our eyes become hollower, our skin will sag. All of those things happen. If you have a lower facelift, well, that's great. It's going to help out with some of the, the jawline. It's going to help out with some of the, the kind of descent of the skin. But what it doesn't do is it doesn't help out with the skin quality at all. In fact, I work super closely with lots of my plastic surgery colleagues, and I will see them to ensure that their skin is as good as it can be, so that when they go and have their facelift, well, actually, it looks really great. You've got, a great facelift, but actually your skin looks younger as well. So yes, you can just go and have a facelift, but your skin will still look old, as
yeah.
older.
And it's a bit of everything, isn't it? But skin health is so important. It's the thing that it's not actually about youth, it's about health when we look at our skin. I mean, don't get me wrong, I love trying to, have little tweaks and things done to my face. I like layering up the whole cake. But there's nothing that can substitute like a healthy glow to your skin, and that comes with really good quality skincare, doesn't it? So someone had another brilliant question there, which is fantastic, because this leads us on to what you're doing here. Someone said, how can I see you, as in you? Somebody said, how can I go and see you? And the whole point of Clearer World, of Clearer, is that they don't have to go and see you in your clinic. They can access you and your skills through Clearer. So that's the whole point of why you founded this, isn't it? Emma founded Clearer, so that everybody, we can all access her without actually, because there's only so many hours in a day. You can only see a certain amount of people, physically get them in the door. So it's a point of heading to Clearer World, isn't it? Because we also have a discount code for you. So if people head to Clearer World, which is the handle, and then you can go there, you can fill on the online consultation and read about what Clearer does, how it would work for you, and also incorporating it into your current skincare routine. Because as we said earlier, we're already using our cleansers, our SPFs, etc. So this is something that you could perhaps use to elevate your skincare level and take it to the next level. Or you're not happy with your skincare at the moment and need something else to address your acne or your issues that you really want to tackle, isn't it? So if anyone is in that situation, they can go to Clearer, and it's a monthly subscription. How does it normally work? You sign up for a monthly subscription?
Yeah, so that's right. So, I mean, to the point of, oh, can I come and see you? I really promise, I really am not just saying this lightly. And if you're coming to see me with a facial skin condition in my Harley Street practice or wherever, you will get exactly the same service with Clearer. So you will be prescribed the same treatments. I will be likely making exactly the same diagnoses in both ways. And I cost a lot to come and see privately, but actually you could end up essentially with, I'm going to say, almost a year's worth of treatment for what it would cost you to come and see me privately without the treatment. And then I'm just going to prescribe that treatment anyway. So it's much more cost effective for yourself, and it's not depriving you of the service that you were going to get anyway. So that's really, I mean, I genuinely mean that whenever I say this. But you can go online, you can do the skin size test for free. So it's quite nice just to understand that little bit about your skin. So go to Clearer World, or it was actually www.clearer.skin, do the test for free. And then if you do have an active skin concern, well, then you sign up for a subscription, and it's a monthly subscription. And if you don't want to continue with it, you can just cancel it when you like. The reason why it's a subscription is because we make you the treatment every month. And most people just found out that they didn't want to have to keep paying every month. They were like, can we just have this come out by direct debit? Because when we first started it just over a year ago, our retention rate of people just continuing to want to stay on it is around 94%. So our patients love these products, and they really, they can see the difference that happens in their skin, and it's not the kind of difference that you see with other types of skincare. So that's why they really like it. So that's the way to do it. Clear.skin, free skin size test. And if you need to join up and get our prescriptive precise formulas, then it's a subscription
you
service.
Have given me a discount code for our lovely, my lovely
yes,
followers.
You got a discount code.
50% off the first month. Which is half price the first month. So if you use Korinna, Korinna, I'll put it in the caption with this post. I think it ends at the end of October, but it's all in the post. But it's Korinna gives 50% off the first month. So bear that in mind when you head over. I've thoroughly enjoyed speaking to you. Thank you so much. Please come back and talk to us again. But there's one thing that I did, Emma, that was really naughty at the beginning. I asked or suggested that people comment after we've left if anyone has any questions they'd like to ask you, or anything that they can ask them in the bottom of this post, in the questions or in the comments below, and you would pop back in and have a little look and answer their questions. So I'm really sorry I did that before I asked you, but I knew you would. I knew you would do it. I knew you would.
No, I genuinely love the skin, which is why I've set this thing up. So,
thank you so much for your time, Emma. Thank you, everybody, for watching, and we'll see you soon. Thanks, Emma. Thank you for having me. Bye.
Okay, bye. Thank you, everybody.